NEET PG and FMGE 2026. What are the types of questions which we expect? So over here, we would be just discussing the types of questions which you expect in your NEET PG and FMGE examinations. So as far as these questions are concerned, just I would like to have your attention, and I would just be going through the things in a very precise, coordinated manner so that you derive max out of this lecture of mine. So as far as the questions which are asked, I have placed it in the similar manner where the examinations in your exams simulate almost in a similar manner. So going to this question number one. Question is image-based pathology. A patient has iron deficiency anemia. Most characteristic feature of cells as seen in slide is. So the image is there and the options are. Now very important to concentrate. Once I put this question to my students, many of them got wrong because of a minor mistake in concentration. So macrocytes with increased pallor, macrocytes with decreased pallor, microcytes with decreased pallor, and microcytes with increased pallor. And you will see that it is basically microcytes with increased pallor. Pallor is increased, pallor is not decreased, as many of the questions, the examination students who answered this question got it wrong. So it is a microcystic hypochromic anemia. That means microcytes with increased pallor, not decreased pallor. So this is very important. The cell size is diminished. The pathology suggests iron deficiency anemia, and there will be increased pallor rather than decreased pallor. So that is very important. That's why the students got this question wrong. It is not only the preparation, it is the concentration on your table which matters a lot. A 45-year-old male has halitosis. The diverticulum below is named after a question image based from ENT, Morrison, Plummer, Zenker, Killian. Now, you know Killian's dehiscence, you know Plummer-Vinson syndrome, you know Morrison's pouch, you know Zenker's diverticulum. These are all important anatomical, surgical, ENT entities which you have to remember. So, what is Morrison's pouch? The hepatorenal pouch. What is Plummer-Vinson disease or Patterson-Kelly-Brown syndrome? What is Killian's dehiscence? What is Zenker's diverticulum? Zenker's diverticulum is an esophageal diverticulum, as you are well aware, and it lies as a weakness in the posterior pharyngeal wall, the Killian's triangle, and patients present with dysphagia, regurgitation, gurgling sound in the neck because of this diverticulum, and they can present with bad, a breath, which is the name given as halitosis. The question line is simple, halitosis, and the diagram or the figure shows a diverticulum. So you have to be well acquainted with such types of image-based questions, and your profound knowledge of anatomy, surgery, ENT, optho, any subject is to be needed. The fundamentals should be there. Now, a bit of a latest type of question. A patient has AAA syndrome. It is characterized by. So basically, you have to know what is AAA syndrome, what is Algrove syndrome. So this is a bit of a new entity which you might not be knowing. So this is a question which you can expect. AAA syndrome is characterized by eclasia, lacrimia, and Addison's disease. So Addison's disease you are well aware, and the lacrimal glands you are well aware. And once there is the tear outflow is reduced, and eclasia esophageal entity which you have to remember. The examiner has given a bit of a AAA confusion in the options: agnosia, Addison's disease, and agnosia, adrenal hyperplasia, lacrimia. So you have to come and arrive at the correct diagnosis. So you should be aware of some of the new entities which are there pathologically existing. Now, this question, image based from pathology. A 56-year-old female has a brain mass 3 into 2 centimeters in posterior cranial fossa. Samoma bodies are seen. So, samoma bodies are seen, and this is a brain tumor in the posterior cranial fossa, Rathke's pouch tumor, glioblastoma, astrocytoma, meningioma. So, an important thing, clue, samoma bodies. You know, samoma bodies are a characteristic typical feature of meningiomas. Meningiomas are usually benign brain tumors which arise from the arachnoid cells, and they have got a dural tail, and the tumor attached to the dura is most likely to be meningioma. So that is a very important thing you have to remember. You should be well aware of the pathological features of glioblastoma, multiforme, which is a very aggressive bone tumor, a very, very lethal bone tumor, butterfly appearance, other like the Rathke pouch tumor, craniopharyngioma, and astrocytoma. But meningioma is classic in the, I mean to say, entity sumama body association with it. Now, a 34-year-old male developed hepatomegaly. He was diagnosed with bronze diabetes. The clinical condition is due to deposition of iron, zinc, copper, phosphorus. A clinical-based question which tests your ability to know what is bronze diabetes. As far as iron is concerned, iron can get abnormally deposited and a condition called as hemochromatosis, and there will be pigmentation of the skin, pancreatic damage, cirrhosis of the liver, and increased chances of hepatocellular SAEs and gonadal atrophy. So you know hemochromatosis, primary and secondary. I will not go much into that, but you have to remember that bronze diabetes is synonymous with hemochromatosis, which is an iron overloading condition, and you have to be well aware as far as your knowledge with standard books like Harrison, like Davidson, like Philip Calra is concerned. So it is important that you study the standard textbook, which will give you an idea, especially about the important topics which are asked in your NEET PG examinations. And the basic knowledge from these books is very important. A young child is diagnosed with McArdle's disease. The disease is usually due to, so the examiner gives you a disease. He wants to know which is the enzyme deficient: liver phosphorylase, muscle phosphorylase, lysosomal alpha 1 for glucosidase deficiency, G6PD. As far as McArdle's disease is given, M for M, muscle phosphorylase deficiency. McArdle's disease, it is characterized by increased intolerance for exercise. Once a child or exercises, he gets increased muscle cramps followed by myoglobinuria, which can precipitate into renal failure. And you have to remember that the muscle phosphorylase enzyme is deficient, and we have to go through the full spectrum of muscle phosphorylase deficiency or the McArdle's disease, which is given in very good books like the Lipid Courts, which I would recommend from myself as one of the best books in biochemistry to be read for these types of NEET, PG, and FMGE examinations. Now, microbiology, child develops severe fever, dengue was diagnosed. What is the classical feature of dengue? What type of a virus is it? What family it belongs to? So it is a member of the Flaviviridae family, single-stranded RNA virus. You have those double-stranded viruses, single-stranded viruses, the DNA viruses, the RNA viruses. What family are they? So you have to remember that this is a microbiological question testing your basic fundamental knowledge about virology, about the classification of the virus, what virus is of which type. So you have to remember dengue is a Flaviviridae virus family, and it is a single-stranded RNA virus with a lipid envelope. And sometimes they ask you the types of dengue viruses, the serotypes, DEN 1, DEN 2, DEN 3, DEN 4 till now. And you have to remember that you have all features about these things like the dengue virus, like the H1N1 diseases, like the I mean to say monkeypox and some of the coronavirus diseases, which are of recent importance and asked quite frequently, in addition to certain other new entities from a microbiological perspective. Now, in a patient with botromycosis, the organism most commonly implicated, again, microbiology fundamental knowledge. Botromycosis is a clinical entity, and what is important? What is the causative agent? What are the features of those causative agents? So, this is a disorder, is a dermatological entity characterized by multiple abscesses in the skin, or it can occur. The abscesses can be deep seated in the organs like the liver, kidneys, lungs, prostate in case of males, and lymph nodes. And you have to remember that botromycosis has been associated with cystic fibrosis, and Staph aureus is the most important causative organism, which is a bacteria. It is neither a virus, DNA, RNA, neither is a fungus. So botromycosis is a bacterial infection, and it is a dermatological entity. And Staph aureus, you have to remember, implicated in so many things like acute infective endocarditis, like lactational mastitis, like hematogenous osteomyelitis. And here you have to remember pulmonary botromycosis or biatromycosis, dermatological botromycosis, or deep laden abscesses within the organs. But botromycosis is a bacterial infection caused by Staph aureus. Remember that much at least. A 34-year-old presents with severe headache and vomiting, fulminant meningoencephalitis is diagnosed. The most common cause among the options given is Trichinella Taenia solium, Taenia sagitta, Naegleria fowleria. Now, there are certain organisms like Acantha amoeba, Naegleria, Pseudomonas, which are so frequently asked. So you have to remember Naegleria as one of the important causative organisms of meningoencephalitis. Severe headache, severe vomiting, fever, and you know all the features of meningitis or meningoencephalitis, which later on occurs. And you have to remember that it occurs due to unhygienic conditions, swimming in contaminated places, and it can occur even in healthy individuals. And you have to remember the role of amphotericin in treating, say, meningoencephalitis as a result of Naegleria fowleria. Do not miss these rare organisms or rare diseases or these real clinical conditions which are frequently asked in NEET, PG, and FMG. Now, a clinical scenario: 33-year-old man working as a pest killer comes to OPD with pain, abdomen, garlic odor on his breath, and transverse lines on his nails. Most likely, he is having poisoning as a result of arsenic, lead, mercury, cadmium. As far as this clinical scenario is concerned, quite frequently asked, but many of the students still get it very wrong because they confuse between different types of poisonings: lead, mercury, arsenic, cadmium. They should know the features of each poisoning very, very specifically. And as far as arsenic poisoning is concerned, you have to remember the Mees lines in case of chronic arsenic poisoning, the garlic odor, the transverse lines on the nails, as well as raindrop pigmentation of the skin, and so many things which I will not go much into over here because the symptomatology over here is clear. The clues are there: pest killer, say pain, abdomen, garlic odor, transverse lines on his nails, and this is a classical feature of chronic arsenic poisoning. So remember chronic arsenic poisoning. It's a very important question. Remember Mees lines, remember raindrop pigmentation of the skin, and say all these transverse lines on the nails. Now, 88-year-old male with high cardiac output having increased skull size, gap, and investigations reveal normal calcium, normal phosphate levels, and urinary levels of hydroxyproline are elevated. What is the likely condition? Renal failure, Paget's disease, osteomalacia, osteodystrophy. So you have to remember Paget's disease is also known as osteoid deformans, and it is a disease which is characterized by increased skull size. The hat which used to fit does not fit now, which is classical example given in most of the USMLE scenarios, now NEET PG as well. And you have to remember the normal calcium and phosphate levels, but increased hydroxyproline activity. And in the later stage of the systemic disease, there will be cardiac failure because of high output cardiac failure. And you have to remember these values: increased urinary excretion of hydroxyproline, which is a very, very important feature of Paget's disease of bone. There is a Paget's disease of nipple, there is the Paget's disease of vulva. Here we are concerned about the Paget's disease of the bone, which is characterized by a bony deformity and which is characterized by overgrowth of the bones in certain cases, and it is also given the name as osteoid deformans. So you have to remember this thing. Now, another question which simulates an earlier question: a patient working in some industry had constipation in addition to punctate basophilia and Burtonian lines. This indicates intoxication with cyanide, mercury, lead, phosphorus. So I told you the chronic arsenic poisoning in the previous question, but over here it is, to say, punctate basophilia, Burtonian line, and you have to remember that anemia, facial pallor, abdominal colic, constipation, encephalopathy as a result of chronic lead intake, and lead line, Burtonian line, or blue line, and lead palsy can present in the form of peripheral neuropathy, wrist drop, foot drop, and punctate basophilia is a very characteristic feature of lead poisoning. That is why I tell you concept, concept, and concept. Concept is important, clinical scenarios are important. Read it in a clinical manner, integrated manner, and that will help you to arrive at the correct answer, which is very badly needed in case of high merit and a lot of competition these days. So you cannot afford to get these types of questions wrong in your exams. Now, a clinical scenario: a 4-week-old child has projectile bilious, non-bilious vomiting, it is non-bilious for the last few days, and there are peristalsis in the abdomen noted along with the olive-sized mass, which is palpable. And by now, you should be knowing that what clinical condition is. Olive-sized mass in a 4-week-old child with non-bilious vomiting is usually as a result of congenital hypertrophic pyloric stenosis. And what would you treat him immediately with? IV epinephrine, surgery immediately, vigorous feeding, and IV hydration and potassium replacement. You know, congenital hypertrophic pyloric stenosis is a clinical entity, and patients present with vomiting, and there is hypokalemia, they present with dehydration. There is this mass, olive-shaped mass, along lung with peristalsis, and immediately you have to respond to the hypokalemic situation. This is one clinical condition which causes hypokalemia, hypochloremic metabolic alkalosis, and you have to give intravenous hydration as soon as possible with potassium replacement. Otherwise, the child will land in hypokalemia. So the first important step would be not epinephrine, not surgery, not vigorous feeding. It is to be maintained balance, IV hydration and potassium replacement in case of congenital hypertrophic pyloric stenosis. Now, important question, and this is some of the latest types of questions. Bronchio-otorhinol syndrome. BORS involves chromosome 5, 6, 7, 8. This question tells you the ability to know the genetics, the chromosomal aberrations, what chromosome is involved in what disease. So there are so many chromosomal entities. What chromosome is involved in cystic fibrosis? What chromosome is involved in Downs, Klinefelters, Patos? So in a similar manner, bronchio-otorhinol syndrome is characterized by bronchial cleft cysts, preauricular pit, small formed air, hearing loss, renal abnormalities, and this is what is a feature of BORS, bronchio-otorhinol syndrome, which was coined by Melnick in 1975. And it is an autosomal dominant inheritance pattern. It follows with the linkage on chromosome 8. So chromosomes, you have to remember, you have to map the chromosomes to the disease, and that's a very important feature of some one-liners which are asked as far as NEET, PG, and FMG is concerned. I guess that by now you get an idea what are the types of questions asked, what I mean to say you have to prepare, how you have to prepare, and this would aid you a bit in your preparation for your exams. Thanks a lot.